But the reality is the things that you do during those years will predict how you are in your 60s and 70s.
Hello, welcome to Mills County Roots. I'm Carlene Hall, and I'm here with Dr. Kyle.
Thank you. Thank you for having me.
Yeah, Dr. Kyle Klute. We're here at Good Life Eye Care in Glenwood, Iowa. This is an exciting day.
It is.
Yeah, you're having a coffee with the chamber here, ribbon cutting.
Coffee and Connections, ribbon cutting today, and then we've got our grand reopening on Thursday.
Okay. Well, tell me a little bit about yourself.
Yeah, good question. I've got a practice, another location in Omaha, West Omaha, and then this is our second location here in downtown Glenwood on the square. Originally, I'm a small town kid from Hampton, Nebraska, which is about 2.5 hours west.
Well, welcome to Iowa.
Town of 400, so small town. I
Yeah,
get it.
you get it.
Yeah.
Very nice, very nice. Well, welcome
Thank
to
you.
Iowa. Welcome to Mills County. It's exciting to see you bring your practice here.
Yeah.
The facility is beautiful.
Thank you.
This was an eye clinic prior.
It was,
to you
yes.
coming to town.
Absolutely. So this is formerly known as Young Vision Care. So Dr. Young had the practice for the last 30, 40 years. Her father before that for 30, 40 years. So we're just sitting on the foundation of 70 years of serving this community.
That's amazing. That's amazing. Well, thank you. I think, if I'm not mistaken, this is the only eye care clinic
It is.
in the county.
It is. The only one in Mills County for sure. Yeah.
Yeah, so thank you for coming in and keeping this available for the local people here. It's a great service, and especially for our older citizens who have to drive quite a ways for particular services. So we appreciate you coming to Mills County.
Absolutely. We're excited to be here for sure.
Yeah, that's great. So now you are part of the Chamber of Commerce here. Yeah.
Yeah, we have been members for several years, and we went to, or I was able to go to my first banquet meeting a couple weeks ago, which was an incredible event. Just a packed house, over 300-400 people, and so it's fun to, it's fun. I don't get the opportunity or experience of, we're with our other location in West Omaha to be a part of such a, localized event where so many businesses know each other and work with each other. I think that's just such a neat
Isn't
thing
that great?
To be a part of it.
Yes, the synergy is amazing.
It is.
It's a good thing. It's a proud thing to be here, to be from here, and to be coming into the community as well. So.
Absolutely. Yeah, there's an energy in the room that was neat, just because it's you have obviously a massive group of people, but they're all really focused on doing. Obviously, we all want to build our businesses, and there's incentives there for us to be there. But at the end of the day, we're about the community, and we are about building the community and creating opportunities for people to use our services and to serve in that way of using our gifts and talents. So
yeah, I love that. Yeah. Gonna fit right in. Right
I hope
around
so.
Here, right? Yeah, that there is a common goal in that, other than, in addition to, I should say, the personal goal. But anytime that you're serving people the way you serve people, that is the heart of someone who serves, and you're helping improve their quality of life. Yeah,
for sure. And one of our, we name our practice Good Life Eye Care. Good Life, some may see that as like, well, that are you ripping on, Nebraska's old state motto, or you're trying to but in our mind, it's like, well, maybe we might be using that. But to us, like, we believe the good life is a very specific thing. We think the good life is about hospitality, specifically about small town hospitality. You all know what it feels like to go into a business where people know you, right? Where people know you, where they love you, where they want to serve you. And that's what we want to produce in our practices. We think that, not to get on my soapbox, I will, I guess.
Go right ahead.
I think the unfortunate thing about the culture of healthcare right now is that we tend to have expertise kind of located in very specific areas, and maybe it's big city or whatever. And oftentimes, if you go to that expertise, it sometimes is divorced from the humanity side of it. It's divorced from the hospitality side of it, right?
Yes.
And so our goal with all of our locations is really just to dive into the specific location and then match expertise. So for us, obviously, our service is eye care. So it's whether it's glasses, contact lenses, or any sort of eye disease, whether it's a long-term chronic thing like glaucoma or macular degeneration, or if it's a short-term thing like a red eye or something like that. We want to take care of those things at an expert level of care. But we want to marry that with like knowing and loving you, knowing and serving you, you know, and then making you feel like you belong here. So I think, like I said, that's my joy of creating, you know, locations and being able to provide that care for patients. Because, like I said, I think that that's the part that's lacking a little bit in our kind of our the culture of healthcare right now.
I think so. I think so. And I think there are a lot of pressures from different directions that create that environment.
Absolutely. Yep.
And technology and the use of technology, and it is a good thing.
Yes.
Technology is a wonderful thing, and the advancements that have been made in the medical industry. But we still need the doctor that cares about you, the doctor that knows you. Years ago, when I first came to town, there was a doctor in Tabor, and his name was Dr. Rodabaugh, general family practice doctor. And Dr. Rodabaugh had delivered several generations of babies, like deliver a baby, deliver the baby's baby, and the baby's baby. And he had a very long practice. But those are the kinds of things that resonate with a rural community and resonate with small town America. Is the doctor that is the quintessential small town hometown doctor. So it sounds like you are bringing that basic involvement back to the into the community. And also after 70 years of the Young family being here, so you're just kind of continuing that service just under a new name with a new with your expertise and your experience elsewhere, and just but bringing those two things together. One of the common things that's happening in these podcasts, we've just been going for about 5 weeks now. So one of the common things that's happening is we're noticing that nostalgia being coupled with what's coming in the future, and that's creating what's happening now. And it's amazing, and we love seeing it. We are on the cusp of great changes.
We are, for sure.
And during these great changes, and they change faster all the time. It seems like technology moves at a breakneck speed, and then it speeds up.
Yep.
So keeping the humanity in that is very important, and that's also been a theme in these podcasts. And I think it just speaks volumes about you. It speaks volumes about the area, but that humanity needs to stay with us, because, as you said, as you get into the intricate specialized medical fields, then everything becomes high intellect, high technology, and almost like I almost hate to use this analogy, but almost like herding cattle through a chute.
Correct.
You know, that's language that we understand around here.
For sure. No, I get it.
But you know,
as a cattle farmer, I get it.
Okay. So, because the needs are high, and there are a lot of people who need that, but in that, you lose the relationship, you lose the humanity, and then you just go through a test, and you go home and you wait for the radiologist or whomever to read the report and send it to your doctor, and you wait to hear from your doctor or someone who works from your doctor. So or works for your doctor. So it's really, really comforting to know that you're patient centric, you're
Yeah.
humanity centric.
Right.
Yeah,
Yeah.
and the heart of what you're doing here is not, I'm a doctor, and
Yeah.
you're really
For sure.
caring for and serving the people.
I mean, it really just comes down to like when I think of my experience growing up, like I said, I grew up in a town of 400. The town adjacent to us, about 6 miles away, is called Aurora, Nebraska. And that's a town of very similar to Glenwood, about 5,000 people, town square. The county building is right in the middle of the square.
Yeah.
So very, very similar. But I remember there's just almost like a built-in accountability. Like when your entire community knows who the chiropractor is, who the couple dentists are, knows who the 2 or 3 primary care physicians are, and you see them not only for your care, but you also see them at events, at the grocery store,
Yes.
right? There's some people can kind of cringe at that, because there's a joy, I guess. And I lived in a big city too. I lived in downtown Chicago for several years. And sometimes it's nice to go to the grocery store and not know anybody, right?
Right.
But also, like, when you have that small town accountability, it does create what I just said, accountability within the system, right?
Yes.
So when you do, it puts us in another position of like, hey, if I know this person, if I know this family, and I know a lot about them, and I'm going to see them Friday night at the game, or I'm going to see them in line at the grocery store, I have to act in a certain way, right? And
Sure.
that creates a certain system that's built in that helps us maintain that human side of things as well,
Sure.
because they're our neighbor. They're not just a patient with a number.
Right.
They're our neighbor. They're part of the community. They own whatever store it is that they might be a part of, or they are a farmer down the street from so and so. So that's the part that I find a lot of joy in, and I think that I guess I'm on a little crusade to like try to create those opportunities for practices to do that. It's honestly a little harder in where our other location is in Omaha, because we have to like work harder to get into communities and find our tribes and be a part of our school systems.
Sure.
And all that, because we want to create that same type of accountability with our providers. But that ultimately, to me, is the best form of care, right? Because it's more holistic. It's not just about, obviously we want people to see really well, right? But we want them to be cared for too.
Right. It is very holistic. Let's talk about the lifespan of the eyes. One of my very first interviews was with the Lions Club. And here in the district of the Lions Club that we're in, they have a push to get these cameras that examine children's eyes
Right.
from 6 months to, I'm sure you know the program.
Yep.
So they're identifying some problems in children's sight before it becomes a learning issue.
Right.
And
Absolutely.
before, I mean, she was telling me that they had a young child under the age of 6 that presented with cataracts.
Right. Yeah, it can happen. I mean, for kids, that's probably one of like the most underserved areas in eye care. And it's something that we're passionate about, and we can take some pictures and kind of go through. We have a one exam lane that's dedicated just to kids. It's our kids lane. But in terms of, like I said, underserved areas, it's really, as our ages, it's really that 0 to 6-year-old. And that's something that we're dealing with just at like in the profession level of optometry around the country, of how do we create better opportunities and how do we train better everyone to be able to care for kids more, because we're realizing that that nearsightedness, like just simple, we always think about like, oh, you're either farsighted or nearsighted. The reality is nearsightedness is something that is growing to like I wouldn't necessarily call it an epidemic, but there's some people around the world, like the World Health Organization is calling nearsightedness an epidemic.
Due to the screen time.
All the screen time.
Yeah.
And so we've got kids that are 3, 4, 5 years old that are already becoming nearsighted, which is well before they should be.
Sure.
And the earlier you become nearsighted, the more nearsighted you're likely to be.
Wow.
Which down the road, maybe we don't worry about that as a 20-year-old, But if you're
Gosh.
really high, if you have a lot of nearsightedness as a 60, 70, 80-year-old, that's a
Right,
big deal
right.
because you're going to have higher risk of glaucoma, macular degeneration, retinal issues.
A lot of research going into that. Are you providing that information to the parents of your young
Right.
patients and sort of giving them advice and
Absolutely.
preventative measures?
Absolutely. Yeah. When we look at it, basically, like right now, the prevalence, if both parents are nearsighted, each child that they have is 50-50 chance that they're nearsighted.
Wow.
If one parent, it's
Yeah.
about a 1 in 3 chance for each child. And
Okay.
if neither parent are nearsighted, there's still a 1 in 4 chance of being nearsighted. That's how
Interesting.
prevalent that is.
Interesting.
Yeah.
Yeah. Wow, that is a strong genetic marker.
It absolutely
Yeah.
is. And in genetics plus just our environment,
Oh,
you know,
yeah,
just
sure.
the demands that we place on ourselves of our phones and
Sure.
our tablets, and then just the amount of near activities that we do these days.
Right, right. So then you get into the school age kids and eyes care. So hopefully, um, if those who have eye care insurance will get their children into
Absolutely.
you,
Yep.
and you can start screening them at 6 months old. Is that
Absolutely.
right?
6
Okay,
months to a year.
so
Yep.
so you can screen them, and thank goodness for the Lions Club and them
Absolutely.
doing what they do because they're reaching some that don't have access
And they're
maybe
creating
to.
awareness, which is always
Yeah,
key.
right.
Yep.
Yeah, so they're making it accessible to everyone, and that's wonderful. So you go through those years, and let's say you have kids that are in school and they're going to school. What is your recommendation for consistent eye care for children all through their school years?
Yeah, great question. So if we go back, essentially we recommend the first exam sometime around 1. And then if everything's okay, then another about 3 years old. And then 5 right at kindergarten. And then if they do have glasses, if they have issues, we typically see children every year through grade school through high school. And if they're if they're low risk, very low risk, they're no need for glasses. Everything's super healthy. We may see them every other year, but most kids should be seen annually because the one thing that oftentimes screenings will miss is what we call binocular vision issues. So we've been given 2 eyes. We've been given 2 eyes for a reason, and that's because we need to see depth. And about 10 to 15% of kids, even though they're seeing perfectly clearly far away or close up, they actually have an issue where they're not lining or they're not aiming their eyes as well as they should. And that can create headaches, it can create double vision, it can create what you alluded to before, learning, visual learning disabilities. And sometimes that may show up as just like, my child has a headache, but they're seeing really well, but they just get a headache. Or it may show up as just somewhat of a stubbornness towards reading or learning.
Sure.
And we may pass that off as like, oh, it could be dyslexia, or it could be maybe they have attention issues, maybe they have a behavioral issue, but those could be visual issues.
Well, I can tell you, as I get older and my eyesight changes, I get some behavioral issues.
I do too.
You get aggravated.
I do too.
That is an aggravation.
sure.
And when you're sitting next to someone who sees something different than you do, or you have to approach it and that's a little bit of a frustration. So just as that frustration happens as we age, it happens in children. Then they're feeling that frustration, and then misconstrued as a behavioral issue.
And they can't really
right?
name it. They don't know what's different.
Right. It's just the tension or the stress and they don't know. So actually, it's a great course of action in, if you're dealing with something that looks like a behavioral issue. Go to the eye doctor.
Right. Get it all
Maybe
checked
it's
out.
that.
Yep, absolutely.
Yeah. Just a like you said, a holistic look at the child. So that's good. You think about, oh, there's the eye doctor, that's where I get my glasses.
Yeah.
But it's bigger than that.
Yep, for
As
sure.
you said, I'm sure there are viruses and infections and different things that you deal with on a daily basis.
Right. Yep.
So pink eye.
Yep.
Yeah.
Pink eye.
You have any
all the time.
advice for preventing pink eye?
Wash your hands.
Wash your
hands.
Yes.
I always tell both if I'm out talking to other doctors or just like talking to patients, if you're, it's helpful to understand like where these things come from. So if it's a child that has pink eye, like 9 times out of 10, it's a bacterial infection that you need to drop for. Okay.
Okay.
And then when you get to adults, 18 and on, if an adult has a red eye, we always think of pink eye, but the reality is it's actually flips. 9 out of 10 times, it's actually not bacterial. 9 out of 10 times, it's actually a virus, like a
Okay.
cold virus.
Okay.
And so most times, if you have pink eye, it's because you're rubbing your eye, or or you had a cold virus that went to the eye, or you've got a family member that had the same thing. But usually the main thing is like, hey, we'll still take care of you and do what we need to do. But typically it's like, how do we prevent that? Wash those hands, keep the eyes, or keep the hands away from the face. You wear contact lenses, obviously, daily disposables are usually the best option for most patients. But yeah, that's those things come in waves at the practice. You can just tell, like, okay, there's things going on.
Something's contagious.
Yes, exactly. Something's going around, and no fun for the time for patients.
Right, right. Well, thank you so much for sitting with me this
Absolutely.
morning and for giving this explanation. I'm not ready to end this, though. I thought I was going to end this, but I'm not ready. We talked about birth through school years.
Yeah.
So as we age,
Yeah.
so we're, like, say, go through college, there's a lot more strain on the eyes in that age group, those 4 or 5 years
sure.
of college, and then step out into your life, and your screen time just increases in the workplace. What is your recommendation for good preventative eye care for the adult?
Yeah, for 25 on or something like that. Yeah. I mean, I'll kind of go through the stages, kind of how I think of things when I talk to patients. When you're in your 20s and 30s, typically you're about 90 to 95% of patients in their 20s and 30s, their prescription is pretty stable. Like, very rarely does it change. About 1 out of 10, 1 out of 20 patients, things will continue to change. And that's not something that's like, a disease or anything like that. That's just reality. Things just continue to change. The things that they got to watch out for, obviously, are just, you have to realize that even though when and I'm not in my 20s and 30s, I'm in my 40s, but when you're in your 20s and 30s, everybody has kind of this mentality that they're invincible, right? But the reality is the things that you do during those years will predict how you are in your 60s and 70s, right? So there's things later on in life that show up, like macular degeneration. There's things, whether it's diabetes or high blood pressure, there's things we can do in our 20s and 30s through diet, through exercise, through just lifestyle choices, that can predict what our future is going to be like. So whether it's, and we check here at the office, we check certain, what we call carotenoid levels, which is basically checking certain, like, nutrients like lutein and zeaxanthin in your skin, because the higher that is in your skin, the more likely higher it is in your inside of the eye, and it protects you from things later on in life. We talk about omega-3s. Omega-3s is just a type of fish oil that's helpful. It's not only helpful for the heart and the brain in terms of anti-inflammation, but it's very helpful for the eyes. We actually prescribe it at a high dose level for patients with dry eye. So there's a lot of things we can do during that stage of life. And some patients will want to do like a blue light filter for their glasses for all the near work, and those are helpful for some patients, maybe not for everybody. But really, it's just thinking about, like, there is a kind of a push these days in the healthcare world about longevity, and I think it's legit. I think it's really something that we should all be focused on. So I think there's a lot of things.
Lifestyle makes a big difference in everything,
sure.
doesn't it? Nutrition,
Yep.
as you said, exercise, washing your hands, taking
Yes.
care of yourself. Yeah, it makes a big difference in everything that functions in the body. So I love your holistic approach. I do love that. My grandmother was very much a stickler about nutrition and being healthy and eating healthy and living healthy. So yeah. But the world doesn't necessarily, in general, promote that.
Right, for sure.
Like fast food, everything's instant, quick.
Right.
Yeah, but it's important. Like, even as a parent, in,
sure.
you know.
And you don't see the hard part too about it is you don't see the payoffs right away. Like we tend to be very wired towards the quick fixes and the quick wins, you know. So like committing to a certain nutrient or supplement every day in order for that 10 to 15 years from now you have some sort of improved life. It's hard to commit to, right?
It is.
It's hard to have the motivation to do that over a long term, but
The
you know,
discipline.
you know, we all know we should, but that's kind of the incentives against that realm of thinking. And that's why it's hard for everybody to kind of commit to that, because it's just, we'd rather have some, you know, magic bullet or some silver bullet to help us right
Quick
now.
fix.
Quick fix.
Yeah.
But the reality is most good things take discipline,
Yes.
time,
Yes. Yes.
commitment.
Yes. And then let's talk about the older generation as you get into your 50s, 60s, 70s, how those eyes change and how you can help support those changes.
Yeah, absolutely. Great question. So the big thing right now, obviously when we hit about 40, 50 years old, we all start to go like this, right?
Right.
And I'm doing it too. Like, that's been a strange thing for me too, as I've just turned 43 myself. So, but that's the big thing. And the cool thing right now about a lot of the research and a lot of the science coming out is that now, you know, in the past, even 5 years ago, there was about 2 options for that. You know, you could wear some certain types of contact lenses, you can wear certain types of glasses with bifocals, you could throw a cheater on. But even in the last 6 months, we've had 2 new drops approved that actually, you put a drop in and it doesn't change your distance vision, but it helps you see better close up.
Oh.
So without glasses, which is kind of crazy to think about, but they're effective and they work. There's different types, and I know not everybody feels like they want to have some sort of surgery to correct anything, but there's surgeries now that you can do basically to exchange your lens for a lens that works better for close-up.
Amazing.
You know, so there are a lot of options. So that's where I get excited to like bring a lot of those new advanced treatments, a lot of those new technologies into our practice. And not that everybody's doing that, but it's like, I want everybody to have the opportunity to do that. I want everybody to realize like, hey, there's like 5 or 6 options for me right now.
Yeah.